Hi, I'm Naturopath Dr Julian Neil. Today I want to talk about how does pelvic health affect everything from posture to pleasure to overall well-being. And I want to look at why it's still a taboo subject. As a naturopath, I often say the pelvic bowl is not just anatomical, it's sacred. It is the foundation of our physical alignment, our emotional expression, our creative life force, and our spiritual grounding. And yet, for far too long, pelvic health, especially in women, has remained hidden in silence and cloaked in shame or embarrassment. Let's first explore the science of the physical foundation itself. The pelvis holds the organs of elimination, the colon, the reproduction organs, the ovaries and uterus, and sexual pleasure, the vagina and clitoris. The muscles of the pelvic floor anchors the spine and supports our upright posture. A strong, balanced pelvic floor helps to stabilize the core, regulate intra-abdominal pressure, and prevent issues like incontinence, prolapse, or even chronic low back pain. But many women experience dysfunction here, whether from childbirth, trauma, hormonal shifts, or even long-term stress. Conditions like pelvic floor tension, weakness, or misalignment can lead to a variety of other issues, such as getting pain during intimacy, or digestive issues, poor posture, low back, hip, or sacral discomfort, bladder urgency, or leakage. And yet, few women are educated about their pelvic anatomy, or more importantly, empowered to explore healing it. It's important to first understand the hormonal and emotional interplay that goes on in this region. The pelvic region is deeply innervated and highly sensitive to hormonal shifts, particularly the estrogen hormone and oxytocin, which influence tissue elasticity, blood flow, and sexual arousal. But the pelvis also holds emotion. It's where unresolved grief, shame, trauma, and even unexpressed creativity can reside energetically. My personal experience in treating women who describe that, quote, tightness in the hips or, quote, numbness in the pelvic floor itself often reflects their deeper emotional imprints. And this is why pelvic healing frequently brings a wave of emotional release, whether it's tears, memories, or even the return of joy. So then we have to ask, why the taboo? The reason in my mind is somewhat simple. Historically, women's bodies have been objectified or pathologized rather than honored and understood. Culturally, conversations around menstruation, sexuality, and pelvic pain have been suppressed. And when we add to that a medical system that often separates body from mind and actually ignores all energy altogether, and then we can see why pelvic health has remained in the shadows. But fortunately today, this is changing. Here's a quick naturopathic and holistic approach I personally use with my patients. First and most important, I stress that pelvic healing begins with awareness, listening to the body without shame. Physically, I often recommend a few different activities, pelvic floor therapies like Pilates, yin yoga, or weight training, working with a trained practitioner to release the tension or build the strength. Practices that move energy that may have been stagnant, but also build muscle strength. Using castor oil packs over the lower abdomen to soothe any inflammation is a simple approach, but for many, a deeper form of detoxification is necessary and requires working with a trained practitioner, especially when we're cleaning the colon. Using Mayan abdominal massage or a form of self-massage to restore circulation and alignment. Again, for some, deeper tissue work such as Rolfing is often necessary. And using herbal allies like red raspberry leaf, dong quai, or calendula to tone and nourish pelvic tissues. Emotionally, I invite my patients to practice many things like journaling and breath work, always where they're focused on the womb space itself or the sacral chakra. Somatic therapies or trauma-informed body work so they can release the held tension and emotion that reside there. And working with a therapist who understands the mind-body connections. Also, engaging in community, women's circles, dance, or movement practices that help reconnect women with their pelvic power and their femininity. Spiritually, this is a creative portal. In yogic tradition, this is the Svadhisthana chakra, the seat of life force, sensuality itself, and creation. We say yogically that your sexual energy and your creative energy are actually one and the same. And so ultimately, yoga is often about raising that energy to the higher centers of the heart or the third eye point. When balanced, it allows joy, vitality, and spiritual grounding to flow freely. And employing rituals like yoni steaming. I spoke about this method in the last video. Meditation with the breath in the pelvis, or simply spending time in nature connected to the earth. All of these can help women reclaim their power with reverence. Here are my final thoughts. Pelvic health is whole body health because it is foundational. It's time we release the taboo and mystery and begin honoring this sacred part of the female body, not as a source of dysfunction, but as a center of power, pleasure, and profound well-being. When women restore balance in the pelvic bowl, they don't just heal physically, they actually stand taller, feel more intensely and with more pleasure, and live more fully. And then ultimately they're able to return home to themselves.